Colloquia. So I'm a Senior Research Fellow in the Centre for Interdisciplinary Trauma Research at AET, and also have the privilege of leading Atawhai and the great team that's behind that mahis. I should also say that I sit on the board of Tauranga Women's Refuge Collective as well, so I've been doing that for a number of years now. Over to you, Elizabeth.
Oh, I'm morena koutou for Elizabeth Eppel. I was born in Australia. I'm the 5th generation descendant of Irish and German ancestors who migrated here in the 1800s. I'm currently in Ahitra area. I got lost on a working holiday in New Zealand some decades ago, married a Kiwi, and so I've worked in education mainly and public policy research in New Zealand for some decades now, and I'm an adjunct at Victoria University, and I have a home in Colloquia. So nice to see everybody there. So Claire and I are going to do a double act today on this presentation. Claire, have you started sharing your slides?
Yes, can everybody see them?
Yes.
Yeah.
Yes. Yeah.
Okay, so our presentation focuses on how we've used complexity theory in the design and methodology of the Atawhai research project, which was funded by HRC. So I'm going to begin with a brief introduction to what is implied by complexity, and apologies to all of the people who are already totally into complexity, because I'm probably telling you only what you already know. And I'm a big fan of people like Dave Snowden as well. And we want to talk about how it then guided our research design and methodology in that piece of research. And in the second part, Claire will talk in more detail about how we used it to uncover how the sustainable approaches to primary healthcare services to family violence emerge from the interactions in the complex system. So just going down to our next slide, Claire.
Yeah.
Sorry, because I can't see. Got my notes up. So what always gets sort of people use complex very kind of freely when they're talking about things. They say this is complex, and quite often they just mean it's complicated, whereas we mean it with a particular thing in mind. So rather than technically complicated or uncertain, we use it to mean more than complicated. We mean something that is unfolding and becoming, and it's unpredictable and unknowable in advance. So the examples here of the jet plane, the sponge cake, and the child being brought up by their parent are examples of that gradation from something that is merely technical and complicated, where a good handbook and a good set of plans will help you replicate the situation all the time. You can build umpteen planes that will all be absolutely the same reliably. So, and equally the cake, kind of, you won't always get quite the same result, but with a good cook, a reliable recipe, known ingredients and a known oven, you're probably going to get a pretty reliable result. Whereas raising a child, much more variable. The science and research tells us what makes for good practice in child rearing, but every child is different, and the outcomes evolve through those interactions that go on all the time between the parent, the child, and their environment, both their human and other biological environment, but also their non-biological environment. So we are talking about that latter, which is an example of what happens in a socially complex system. So just talking about complexity theory as a an approach to discovery, to research, it's worth locating it among some of the other theoretical traditions that are used in the social sciences. So here I've named 4 broad traditions which are used in the field that I work in, where on one end we've got the scientific approach, where there's the hypothesis, the deciding you're going to probe for the occurrence of that and the cause and look for the cause and affect relationships. Complexity theory informed approaches can sit comfortably with any of those, but probably more comfortably in the 2 and 3 than in the 1 and 4. The important thing is that the tools that have been developed in those fields need to be tested and understood for being compatible with the complex adaptive system and what we know a complex adaptive system to be. So I'm going to move on to talking about what we think this essence of that is. Before I do, I was just simply going to, at the risk of scaring you, someone, but quite conveniently, has written a little map, because the use of complexity theory as an approach to knowledge has really only evolved in the last half of last century and into this century, and has become increasingly common. I mean, the fact that just as we introduced ourselves, that several in the audience said this was a field that they were interested in, whereas when I first started researching in this area, it was pretty uncommon, it was pretty new, and there were very few papers, but the number has just done the hockey stick thing. So the use of complexity theory for understanding what we know to be socially complex has become increasingly common. And so it's just simply saying that it's not an either or, but an and is it complexible? Is what you're doing compatible with what you know a complex system is behaving like, so that you can see what you want to see. So just to then go on to, so what do we understand the complex system to be? And so the essence of that is that we've got interaction happening among all the parts of whatever the system needs to be. And Claire mentioned, no, maybe she didn't, but we will talk a little bit about the idea of a boundary. Quite often the problem is that we've artificially put a boundary around something, whereas in fact the nature, the boundary is something that we should pay a lot of attention to, because we're not really sure what the boundaries are, but what boundaries there are actually humanly created. So our starting point is knowing that there will be interactions going on between all the constituent parts in an adaptive system, and they're all being affected by and in turn affecting other parts of the system in an ongoing and non-linear way. And that is the essence really at the core of it. But the result is that ongoing interaction is creating endogenous change, that is, change generated from within and not by external forces. And the non-linearity of those interactions, that is, they're not matched, means that what happens next cannot be controlled or predicted. So in essence, what we see is some emerging patterns, and the patterns are created by the feedback loops that are going on, which are either amplifying each other and making change emerge, or they're undoing each other and making the system feel like it's stagnant and unlocked in and unmoving. So the pattern of change is important, and what's generating that pattern of change. But the emergence of the new pattern is often the interesting thing, and what is driving that. In such a system, some people wrongly think the system, if it's locked in, is in some sort of equilibrium, whereas the complexity people would say, no, it's far from equilibrium. And in fact, small changes can produce totally disproportionate large effects. which we might call a tipping point, and that tipping point can make the system come out in a whole new pattern. And that's one of the things we're interested in. So this little cartoon is just capturing the idea that we're actually trying to look in the places where the light isn't so bright, but where some of the answers might be. So the traditional tools are very good at looking underneath the light for answers that might not be there. Whereas we're looking to use tools that might help us look in the dark and understand what is going on behind the scenes, under the radar, in the interactions between the parts of the system that are generating the sort of changes that are helpful. So what we intend to do now is explain how complexity theory as a theoretical lens was used in our Atawhai research projects to understand responsiveness of primary healthcare to whānau experiencing family violence. And at this point, I'm going to hand over to Claire, and I'll come back again at the end of the seminar.
Thanks,
So
Elizabeth.
Claire.
Thank you. So the moimoia, or the vision of Atawhai, is for primary care to be known as a safe place to seek help for family violence, but also that providers feel confident and capable in providing a helpful response. Right now, there's limited system support that supports primary care to respond to family violence, which can leave providers unsure of what to do or how to help. This gap was first highlighted through the Ministry of Health Violence Intervention Program that Jane leads, and her and I were working on it at the time. So back in 2008, to address this issue, we conducted a Delphi study that was funded by the Ministry of Health to produce what we call the Primary Healthcare Family Violence Responsiveness Evaluation Tool. This tool included 143 items across 10 domains, ranging from governance and leadership to screening and documentation, all the way through to quality improvement. And it was phased to guide the implementation of a response within what we had at the time was PHOs and general practices, or hauora. And we pilot tested the tool in 6 different sites and then followed up 2 years later. And what we found was that implementation was really challenging, and the sustainability of a response was even more so. And I'm telling you this little story to illustrate how different our approach is to this problem now. I first came across complexity theory in a 2006 paper by Thurston and Eisner, which argued that there was a lack of attention on the systemic and structural factors that was influencing domestic violence screening, implementation, and sustainability. So they argued that scholars ignore the complexity of the healthcare systems and instead aim for simple solutions with linear models of cause and effect. And that argument resonated with me, and I began a PhD using complexity theory to explore what affects sustainable response in primary healthcare. So I reconceptualized the problem as a complex adaptive system to be able to view the patterns of interaction between the many parts of the complex systems, which are family violence and healthcare. And I chose to take a post-structural position, recognizing that all the elements involved are constantly shifting, creating a lot of uncertainty about what might happen. And this position led us to theorizing that sustainability is an emergent phenomenon that occurs when the person and the provider interact in a way that creates mutual benefit and sets a trajectory towards sustainable outcomes. So it's something that sustainability is something that we always have to be working towards, not something that can be achieved in perpetuity from this perspective. So how does this influence research design? A 2009 paper from scholars at the University of Texas asked, what if we could design research to shift and change as we learn about the nature of the healthcare systems we're studying, rather than being bound by preconceived plans? So they argue that research design should be research design should be treated as a verb, not a noun, as an activity, not a product. Because as soon as we look at a system, we change it. Therefore, we're participating in the design process. This adaptiveness suited our intent, as we didn't know what we were looking for. As Elizabeth said, we were looking in the dark. So we needed to be able to be responsive to what we were learning along the way. And to do that, we had to bring multiple methodologies and methods together to search for the patterns that we were looking for. Each of these methods would provide a different, but again, valid view of the same question that we were asking. So you can see in the figure provided that the Atawhai research design wove together Te Ao Māori principles, complexity theory, and participatory research as our methodology. And Atawhai is strongly grounded in Te Ao Māori principles to ensure that our approach reflects Māori understandings of wellbeing and honours our commitment to te tiriti. These principles also ensure that our solutions will be meaningful for whānau Māori and help disrupt colonialist systems and structures that shape people's agency and choices, not only for Māori, but for all populations in Aotearoa. So what does this look like in practice? So back in 2021, we brought together 14 primary care professionals and 10 one-day wānanga, where we asked them what would make it easier to respond to family violence in practice. And our primary data collection methods were the wānanga and our kaihopu kōrero, which loosely translates to conversation capture. And these kaihopu were two senior researchers on our team that observed the workshop, took notes, but also gave feedback to the participants and challenged them on their kōrero moving forward. And we also used 3 methods to capture change. We had a pre and post readiness survey, social network analysis, and exit interviews. And I'm happy, I'm comfortable to say that the first wānanga that we had could have gone better. We found it quite difficult to communicate the approach that we were using to the participants. So while we were there asking them what the answer should be, they were there thinking that we were going to offer them a solution. So there was a lot of confusion in that first wānanga about the approach. And this quote illustrates the uncertainty and the confusion that the participants went through. So this person says, a lot of Atawhai was not what I had expected it was going to be. I think part of that was that it was kind of an organic process, and I didn't realise that going in. You may have heard from the way that I'm speaking that I come from a place of wanting to know what was going to happen and wanting things to be kind of scheduled and straightforward. I found in the beginning I didn't know what they wanted us to do, and I really struggled with that and thinking, I can't answer the question if I don't know what they're asking. And as time went on, I realised we were kind of meant to be figuring out what the question is when we're in the wānanga. And once I made that shift, I found them really interesting and useful and thought-provoking. So I'm just going to pause here. This image here. So this is a pathway that footsteps of people have created organically. And this is the type of pathway that we were trying to find in Atawhai. So it's not a man-made one that's existing already, but it's one that has been forged by people who have gone before us. And these are the tools that were developed by our participants that illustrate that pathway through the trees, or the pathway towards sustainable responses to family violence. So we had our tikanga, our common language, our kōrero, our gems, and our pathways towards change. And all of these resources are on our website, atawhaitia.co.nz. So at the end of that project, we realised we needed to understand what matters to whānau when they're accessing care and family violence as a part of their life. So we were funded again by HRC to conduct this project. We were using the same Atawhai methodology with whānau interviews, wānanga, and different methods to capture change. So this project is kind of the other side of the equation, the sustainability equation that I talked about. So we've got on one side, we know now what health providers need to do this mahi well, and this new body of knowledge that we are currently creating, what matters to whānau. So when we bring those two bodies of knowledge together, we're anticipating that we'll be able to get improved service delivery. And we are currently in phase 2, so we're interviewing whānau about their experiences at the moment. And then phase 3, we'll be bringing the health professionals and whānau together in a wānanga so we can communicate what's needed for better service improvement and figure out a way to make that sustainable together. And just to acknowledge everybody that's involved in the team. I don't know if you saw as I was talking of how the team has grown over the years. We now have a lived expertise group within our research team called the Hoa Haere Kōtui, and we also have many community partners and supporters as well. So the network is really growing over the last 5 years. So what are the implications of complexity for research design? We need to be aware of the artificial boundaries, as Elizabeth was saying earlier, the artificial boundaries that we place between what we think of the problem, what we think of the context, and therefore what the intervention looks like. So during our participant wānanga, we saw a transformative change occur as participants learned from one another, critically reflected on their own thinking around family violence, and therefore changed their practice. But it was as they were learning from each other through discussion that these artificial boundaries actually became more visible and renegotiable. So we saw that the problem is not a fixed entity, but it's an evolving product of the context that it's discussed within. And that context is constructed and negotiated by those who are involved in those discussions. And therefore, the intervention, what the intervention looks like, emerges based on how the problem and context are understood. So, for example, if you're looking at a more prescriptive approach, such as the evaluation tool that I mentioned earlier, it's got a different understanding of what the problem is and how we might go about a solution, versus the Atawhai, what we've developed through Atawhai is a more relational approach. And I'm going to hand it back to Elizabeth.
Right, so kind of bringing that all together, what we're saying is, as Claire indicated, the research is telling us that we can't be prescriptive about what is going to work. We're looking, we're evolving our thinking about where we need to look and how we need to look. So we're adaptively learning as we apply the methodology where the answers might be lying, and that's as each little bit opens up another door. There's both adaptiveness in our approach and the willingness to bring in new tools. So, for instance, in the work that Claire just described with respect to the first Atawhai project, we hadn't anticipated the exit interviews at the beginning of our research process. By the end, it was obvious that we really needed to know a little bit about what the participants were thinking compared to where they'd started, and that's what the exit interviews helped us with. And as I suggested a moment ago, that we could call it a boundary vehicle, a starting point with some principles, some approaches, some values that would guide a pathway. So it could be picked up by an individual primary healthcare practice. It could be picked up by an individual practitioner. It could be picked up by a system in terms of the wider te arere kura. It's kind of what does it mean in terms of how the system provides, but it certainly would suggest that simple thinking like standard questionnaires, standard guidelines and so on are not going to work. And I think Claire's given me that final line, you know, you might think you've got a plan, but the plan needs to evolve as what you know evolves. And so your methodology is a flexible one. It's one that's capable of shifting according to what you know. So I think we might stop there and people might have some questions for us. So we're happy to answer your questions.
And just before we do, Elizabeth's been really kind and added some supplementary materials of complexity-friendly tips and tools. So we'll put the presentation online for people to be able to download that. Is that okay, Elizabeth?
Yep. Thank you for saying that. My brain's just 2 hours behind yours.
I think, have we lost? Oh, no. Yeah.
So
Yeah,
does anyone have any questions or comments for Claire and Elizabeth? I think we can probably end the recording now, and then we'll have some questions and answers. So why don't just join me in thanking Claire and Elizabeth for the presentation. So thank you.
we lose her now. I think she hit the wrong button there. Does anyone in the room have a question for us? Or comment?
I don't have a question, but definitely a comment. I just want to say thank you so much for the presentation. And as a disaster practitioner, it's really good to see different ways of the stuff being delivered with participants. So thank you so much.
Thanks, Todd.
I definitely